Now, stakeholders are calling on government and well-meaning Nigerians to help make accessing healthcare services stress-free and make life more meaningful for the people and ensure connectivity between citizens and healthcare providers so as to curb healthcare crisis in the country. The Director General and founder of Hana Foundation, Oke Ugumadu, lamented that the Nigerian health system is relatively weak and there is yet a coordinated response across the country to curb healthcare crisis in Nigeria, adding that number of health workforce crises have been due to poor welfare, lack of appropriate health facilities, plus several months' salaries owed. Ugumadu made this known to the public during a health conference themed Healthcare Crisis in Nigeria and the Case for Remedial Action. He added that poor administration and response across different levels of government have played contributory roles to further internal crisis among health workers. These crises have consequently prevented optimal healthcare services delivery to Nigerian population.
The main issue is that greater percentage of Nigerian doctors are moving out of the country because they are not well taken care of here. And this goes back to the government. So if government can play their own part, and you see that doctors will be here, and nobody wants to live here. I've been outside the country, and I know that those who are there because of the money they get. They prefer staying here if they are taken care of here. The government, to provide a level playing ground for medical practitioners to have the assurance that if they put in their best, that their family will not suffer. You know, the reason for all this is that if they spend all their experience on here, at the end, their family will be suffering. So they need to neglect them. So if government can come in and subsidize the extent, if money that is used to subsidize oil just in 1 month is moving to health sector, we will not be talking about this.
The keynote speakers at the health conference emphasized on the importance of wellness of every Nigerian, stressing that higher levels of wellness are associated with a decreased risk of diseases, illness, and better immune functioning, speedier recovery, and increased longevity. They further added that individuals with high levels of wellness are more productive at work and are more likely to contribute to their communities.
The medical model we have is part of the crisis. There's not enough emphasis on wellness. Notice, I did not say disease prevention, I said wellness. We're doing okay with disease prevention in terms of screening and stuff like that. But in terms of wellness, which is putting the body in a state whereby the body is resilient to the onslaught that comes in, whether it's viruses, whether it is stress, or whether it is certain kinds of nutrition. I touched also on how our nutritional model, agricultural model, is undermining us. The question earlier about organic foods.
Basically, government must take the lead. You know, it's the public health extension is still the best way to change the statistics of poor health in Nigeria. This also shows that it's possible to have universal access for health for the common people. And I think that is what we need to emphasize without necessarily looking at the statistics of possibility or not. It's really possible.